The Sanders campaign announced it was canceling a rally scheduled for tonight in Ohio. The governor has declared a state of emergency and urged groups not to hold large indoor events.
Whenever we do rallies, we consult with public health officials because the last thing in the world that we will ever want to do is put anybody in danger.
A short time later, the Biden campaign canceled a Cleveland rally of its own. Touring an auto plant in Detroit earlier in the day, Biden got testy with a man who asked why he wants to take away guns.
Now, shush. I support the Second Amendment. I did not say that. That's not true. I did not say that.
The exchange came as polls show Biden with a sizable lead in Michigan, today's biggest prize with 125 delegates. Another big Biden win would be a blow to Sanders, who won Michigan's Democratic primary 4 years ago with his appeal to working-class voters.
Michigan is obviously a very important state today, and there's a lot of delegates up there.
Exit polls from 3 of the states voting today show that Democrats overwhelmingly believe Biden, rather than Sanders, is better prepared to handle a major crisis like the coronavirus outbreak. And both campaigns say they'll evaluate on a case-by-case basis when and where to hold rallies in the coming days. Tanya?
Ed O'Keefe, thank you so much. Let's bring in Linda Tran, Leslie Sanchez, and Caitlin Huey-Burns. Linda is a CBS News political contributor and Democratic strategist. Leslie is a CBS News political analyst and Republican strategist. Caitlin is a CBSN political reporter. All right, so Caitlin, let me start with you. You know, the Sanders and Biden campaign, we just heard, canceled their events due to fears over the coronavirus. How much is this virus an issue going forward?
Well, from a practical standpoint, it's keeping them off the campaign trail at a critical time, especially for Bernie Sanders, because he needs to do well in Michigan tonight, and he needs to do well in Ohio next week if he is unable to do well in Michigan tonight, because that's kind of where his base of support or his appeal should be. But from another standpoint, a thematic standpoint, likely, is that this is actually in the minds of voters. This is something that's affecting them in their states. It's something that they're thinking about when they're thinking about what a leader looks like. And in our exit polling showed that amid the coronavirus concerns, voters thought that Biden showed more leadership or had more trust in his leadership than Bernie Sanders. So if Biden does well tonight, that could be something that colors how voters have been thinking about this decision today.
Absolutely. And Linda, our exit polls found most voters in Michigan and Missouri say Biden is the candidate they trust most to handle a major crisis. What does that mean for both campaigns, especially now?
Well, the fact that Joe Biden is somebody that they say they trust in a moment of crisis should come to no surprise to people who are paying attention. I mean, he was the sitting vice president. He had been part of many critical decisions and crises that happened during the Obama administration. So it stands to reason that voters broadly feel like he's the right person with the right experience at a time when there's a lot of widespread anxiety in people's communities, and people are very much worried not only about the kitchen table issues that always drive concerns in every election, but also worried about basic health concerns and whether or not coronavirus specifically is going to be a factor in their households. So this is a problem, of course, for Bernie Sanders because it was part of his narrative last cycle when he had a rather come-from-behind victory over Hillary Clinton in Michigan. And so the bar for him is pretty high. And here is a place where both Joe Biden and Senator Sanders have competed very strongly for the support of labor voters in particular. So this is a do or die moment for Bernie Sanders, as Caitlin said, and it's going to say a lot about the future.
Now, I want to get to health care in a moment, which you brought up. But first, Leslie, I want to ask you how much attention should the president and Republicans in general, for that matter, be paying attention to this, to these sorts of polls showing that voters trust Biden in a crisis?
The biggest issue, Tanya, is that it's very unlikely people will want to shift kind of their horse midstream. And there's a lot of interesting things that are happening on the campaign trail. That video that we showed with Joe Biden getting particularly testy. So the question becomes, okay, certain type of leadership, but do you want an unorthodox, kind of a boisterous, confrontational candidate or person who pushes against the opponent, or do you want a confrontational, boisterous person who pushes against voters? I mean, really, the choices are going to become extremely stark if you do get these two candidates, meaning Joe Biden and Donald Trump, against each other. Right now, all the advantages are to Trump for that reason, because I'm going to argue that this is artificially inflating Biden. And all of the weaknesses that he had, that Sanders was able, and his campaign was able to take advantage of, they're temporarily blunted, and we just don't know how that's going to play in the next several months. So it's going to be who has the stamina, and right now the advantage of the bully pulpit and the resources of the federal government go to the president.
Right. Okay. So, Caitlin, I do want to turn back to health care. As we know, health care has been an issue on the minds of voters, throughout this campaign cycle. Now it's on the minds of voters in a different way, though. It's not just about how do I pay for my health care, but it's about can I get a coronavirus test if I need one? So is this going forward going to become the issue in a lot of the battleground states we still have yet to see?
Well, we see in our exit polling tonight, and we've seen in primaries and caucuses across the country so far, that healthcare remains the top issue for voters. They're concerned about the costs. They're concerned about their prescription drug prices. They tell us they're concerned about access. They're concerned about changes to their healthcare system. So it's a nuanced issue, but it's a top issue on mind. Now, this adds another layer to it, certainly, with the coronavirus. It also adds the layer of management of healthcare, management of access to getting testing, that you believe your government has things under control. These are all issues that are kind of layered into this overarching issue that voters really care about when it comes to healthcare. Because remember, healthcare speaks to something that really affects voters personally. Anytime you add some kind of changes to it, people react. Anytime there are any kinds of threat to your healthcare, people react. And so that's, I think, an element that we're seeing here as this issue continues to move on.
It just gets heightened. All right. So, Linda, how should Democratic leadership then use this trend to ultimately craft their general election message?
Well, I think we've long said that Democrats, whether they're running for office or they're hoping to turn out voters to support their preferred candidates, need to be talking about health care because that is top of mind for voters, as Caitlin just laid out. I do think in this particular scenario with coronavirus and all of the very visceral and personal fears that people have, I mean, as a parent, I'm getting emails on a daily basis with updates about my kids' schools, and many, many voters around the country are facing the exact same thing. This is a time to put the partisanship aside and to make sure that we're very clear about the facts. I mean, the reality on the political calculus of all of this is that, we have long talked about how important credibility is in the White House in normal days, how important it is to have people believe what you say when things are going at a regular clip. And when there's a crisis like this, the White House under the Trump administration and his leadership is already challenged. There's no need for Democrats at any level to add anything to that.
And so, Leslie, President Trump has so far failed to pass any meaningful health care reform. And, that was a campaign promise. So how do Republicans craft a campaign message around health care with that in mind?
Biggest opportunity is the $8.3 billion that was a bipartisan effort that was released immediately at the beginning of this crisis. People have to think about these resources were moved a monetary relief to, and those are real dollars that are getting to the governors, getting to the states. You're hearing Vice President Pence talk about that he has a good working relationship with Democratic governors. I think Linda's exactly right. That if you move aside the politicalization of it, it's an issue of presidential management. Is he putting the task force together? Is this a triage situation where you can get economic, whether it's going to be payroll tax relief, health care access, all of those pieces need to come together, and that will look like his health care response. It's not like a repeal and replace of Obamacare. It's a very different element that he's putting forward. But the question, I'm going to just, again, talk about one of the areas of weakness is going to be these vulnerable communities. Are they going to feel safe and confident to go into a doctor if they have any of these symptoms? And of course, there's this, of course they can, it looks like now they'll be able to get the test if they need it. But encouraging those communities along with everyone else to be part of this solution is going to be a challenge for this administration.
All right. Caitlin, in Michigan, Mississippi, Missouri, and Washington, voters say they prefer a candidate who can beat Donald Trump to someone who they agree with on all the issues. So is this issue of electability going to be key in the race going forward?
Yeah, and we've been hearing that from voters since January of 2019 when we started following these early candidates getting into this race, that electability, this issue of who can beat Donald Trump, was top of mind for voters. And we've seen that be a bolstering argument, especially in the past week, for Joe Biden. Candidates getting out of the race and endorsing him. We've talked to a lot of late deciding voters who said that was something, this electability issue, and others verifying the idea of electability for them, because it's a very difficult issue to define, having an impact. So overall, that I think is the biggest thing to watch tonight and moving forward. And it's something that, as Bernie Sanders has made Medicare for All his chief rallying cry, something that he's campaigned on vigorously. These policy issues are just taking a back seat for now for Democrats at large who have this broader priority of defeating Donald Trump.
And that's been a real movement, wouldn't you say, in the sort of the Democratic Party, as to when we saw the beginning of the primary season sort of flesh out. Policy seemed more important, didn't it?
Yes, there was a lot of policy discussion. You've seen candidates put out lots and lots of reams of white papers and policy proposals, especially Elizabeth Warren. But when it comes down to it, what we've been hearing from voters is that this idea of electability, however it is defined, is top of mind. And I think it's also important when we're talking about the coronavirus and the impact that this could have on the election. Remember, the election is months and months away. It's very difficult to assess what will be happening in November, but the economy is the president's main pitch here in his re-election campaign, and we're seeing the economic impact of this as well. If that lingers, that's where Democrats may be able to step in, because Democrats have a challenge of running on an economy that looks fundamentally good on paper. They've been arguing that it doesn't always look that way. How does that translate? I think that's another element in addition to health care.
Yeah, I think you're absolutely right with that. So, Linda, in terms of this idea of electability, how much pressure is there on the Democratic Party then to craft a narrative that, President Trump has to be defeated at all costs?
Well, I think that Democratic voters are already convinced that Donald Trump needs to be beaten at all costs. I mean, we are seeing this in the extraordinary turnout that we're seeing in a bunch of the states that have voted already. South Carolina actually hit historic turnout levels, and many of the states on Super Tuesday saw the same. So there's no question that there is a ton of enthusiasm among Democratic voters, and one of the impetuses behind all of that is this desire to take on Donald Trump, this desire to move on from the chaos that we've witnessed over the last 3 years. We also saw that in exit polls last Tuesday, on Super Tuesday, 82% of Democratic voters said that they would support the nominee, whomever it is. And so this really speaks to the point Caitlin's made about not necessarily being tied to the policy, but just wanting to get somebody out there that they think is going to be strong. In both Joe Biden and Bernie Sanders, I think depending on which voter you're talking to, they feel like, they've picked the right horse and there's no going wrong on that front.
All right. So, Caitlin, Biden and Sanders have both been campaigning hard in Michigan. Remind us why this state is so important.
Well, it's important tonight because it has the most delegates of all the contests tonight up for grabs. It's also an area that Democrats have been trying to win back after 2016, and they have various ways of going about that. There is this question of, do you try to convert Trump supporters back to your camp? Do you try to turn out numbers among African-American voters in places like Detroit? Do you do it by really targeting women who were a decisive force in the 2018 midterms and helped to flip 2 congressional seats in 2018 in Michigan and the governor's race? Gretchen Whitmer, of course, the governor there, endorsed Joe Biden this week. And so there are varying ways that Democrats are feeling about going about it. I think tonight, we're looking at what the demographic breakdowns are, what the coalitions that the winner actually builds. I think that will give us a good indication of how Democrats feel that they can win moving forward.
Right. Those numbers are telling. And Leslie, this was a state that helped propel President Trump to victory in the 2016 general election. So what is his campaign watching carefully for tonight?
They're paying a lot of attention to the blue-collar workers, certainly the ones that Joe Biden is having confrontations with. I mean, that is really a coup for the president in many ways, that is showing, one, just kind of temperament, but two, he's shooting at the wrong messenger in terms of, where he's aiming that fire. And that's what the president is doing. He's continuing to double down on economic relief for blue-collar workers, folks that are on, with their hourly wages, just the economic downturn, this blip that we're having, hopefully short term, with the coronavirus, is trying to find a way to soothe those fears. And that's what he did today. And we can't ignore the impact of having these daily press conferences and the president out there, because we know things will probably turn worse before they turn better. But these are voters who are particularly paying attention. So are they going to respond to Biden? I think he'll do well today, but it still tends to be a Democratic conservative base. And that's why this issue of guns and certainly issues of health care and payroll are really important.
Right. Republicans, I imagine, are going to be watching really carefully to see, like you said, where those, blue-collar votes go. Linda, 62% of Biden voters in Michigan say they made up their minds in the last few days. So is this something we should expect to see moving forward into states like Florida and Ohio? And does this sort of last-minute decision-making mean that people are not so excited about the candidate? Because then if they were, wouldn't they have made up their mind, weeks ago?
Well, I think it's very consistent with what we've seen across all of the early states and the Super Tuesday states, with people thinking about who they need to throw their support behind up until the very last minute. So that just has been the hallmark of this campaign season. I do think in Michigan in particular, having Joe Biden on the ground, having him be able to make the pitch that, remember, he was part of the administration that rescued the auto industry, being able to hear that firsthand, I think, is really important for people who are still, struggling, who are still trying to figure out a way to dig themselves out in a lot of different ways, and now maybe eyeing this significant economic downturn with a lot of fear and a lot of bad memories about what came to pass before Barack Obama and Joe Biden took office in the first place. I do think that as we move forward, you are going to start to see fewer and fewer voters making a quote-unquote last-second decision as they start to recognize that it's a very, very clear and definitive choice between Bernie Sanders and Joe Biden, as these two candidates are extraordinarily different, both in terms of their approach and in terms of their policy visions.
Right. All right. Well, Linda Tran, Leslie Sanchez, and Caitlin Huey-Burns, thanks to all of you. We really appreciate it. And a reminder, Cbsn will have live results from tonight's key contests in 6 states. The polls will close in a little less than an hour in Mississippi, Missouri, and North Dakota. The big one is Michigan, where most polls close at 9 p.m. Eastern. We will be checking in with our decision desk throughout the night to keep you updated, so be sure to keep it right here for the very latest. There are more than a dozen states of emergency in effect across the U.S. due to the coronavirus. As the number of cases continue to rise, parts of the country are starting to shut down. We've just learned the Coachella Festival in California has been rescheduled for October. Meg Oliver is in New York, where drastic steps are being taken to contain the virus.
Here in New Rochelle, they're setting up a 1-mile containment area around the synagogue considered to be the epicenter of the coronavirus cases here. This is not a quarantine, but a ban on large gatherings inside the zone.
This is literally a matter of life and death.
New York's governor announced unprecedented action, calling in the National Guard to try to prevent the spread of coronavirus with a containment area in New Rochelle, population near 80,000, considered the epicenter in this state. Tonight, they're among more than a dozen states under a state of emergency. More than 100 schools or districts in the U.S. are now closed.
It's devastating not knowing what you're going to do last minute in regards to babysitting and daycares.
They are part of more than 360 million students worldwide who are not in school due to the virus.
It has impacted us, but obviously we want to make sure everybody's safe, so we're just complying like everybody else.
Today, Harvard University joined a growing list of colleges from coast to coast, canceling classes and telling students to go home. The United States is starting to shut down as millions of Americans are working from home. Companies like Amazon are advising employees to do so for the rest of the month. The coronavirus is hitting airlines especially hard. American, Delta, United, and JetBlue are reducing flights. Southwest is expected to lose up to $300 million in revenue.
Here, misses on the floater.
With the CDC warning against large gatherings, the sports world responded, limiting locker room access to players and staff. The Ivy League canceled their men's and women's basketball tournaments, and pressure is mounting for the NCAA to take some sort of action before March Madness.
Here's your clue.
And spelling out the widespread concern, live audiences are banned from popular game shows like Jeopardy and Wheel of Fortune.
Within days, the National Guard will arrive to help distribute food within the area of the 1-mile radius. Tanya?
Meg Oliver, thanks so much for that report. President Trump's coronavirus task force says more testing kits are on the way, but new data shows far fewer Americans are being tested for the virus than in other countries. And there are new concerns that the lack of testing could make it impossible to track the disease. Dr. John LaPook explains.
Today, Health and Human Services Secretary Alex Azar said as of this week, America has ramped up its production of coronavirus tests.
1.1 million tests had been shipped out to public health laboratories and private labs and hospitals. At this time, another 1 million tests are available to fill orders or are being shipped.
But according to a database looking at state results, just over 5,000 people have been tested in the United States since January 20th, when the first positive case was detected. In comparison, South Korea is now doing more than 10,000 tests per day. Tonight, the administration still has not explained why it refused to use a test created by the World Health Organization weeks ago. By the end of February, 60 countries had reportedly gotten test kits from the WHO. But the Centers for Disease Control reportedly decided to create its own version as the virus was spreading.
No one is answering that right now, and I am really frustrated with that. I'm frustrated that it happened.
And without knowing where the positive cases are, public health officials are hampered in their efforts to track and contain the virus.
We are only going to get on top of this outbreak if we know who is affected and able to, quarantine people rapidly.
Some state health departments say they're worried.
We've only received 2 test kits to date.
On Capitol Hill today, CDC Director Dr. Robert Redfield was asked about the nation's capacity for testing.
We've underinvested in the public health labs.
There aren't enough people to
There's
run
not
the
enough
tests?
equipment, there's not enough people, there's not enough internal capacity.
Wider availability of testing will make a huge difference for clinicians in their ability to make a correct diagnosis, and will also help public health officials get their arms around the extent of this crisis so they can try to come up with the best strategies for containing it. Tanya?
Dr. LaPook, thank you so much. The White House is proposing several economic relief measures after virus fears hit the stock market. It comes as President Trump brushes off concerns he may have been exposed to the virus. CBS News White House correspondent Weijia Jiang has the story.
President Trump insists he does not need to be tested for coronavirus.
I feel extremely good.
Even though he's had close contact with members of Congress who were exposed to the disease, like Congressman Matt Gaetz, who rode with him on Air Force One yesterday before he tested negative.
Spoke to the White House doctor. He said he sees no reason to do it. There's no symptoms, no anything.
The president also claimed the country's economic pain due to the virus was overblown.
It will go away. Just stay calm. It will go away.
And though the markets finished up almost 5% following yesterday's nosedive, the administration is pushing several measures to bolster the economy, including paid sick leave, loans to small businesses, and a payroll tax cut. But both Republicans and Democrats said that was unlikely to pass.
You know what doesn't help stop the spread of the coronavirus? More corporate tax cuts.
The virus's impact on the travel industry is also a major concern. Airlines are slashing flights and freezing hiring, while cruise ship companies are being forced to scale back.
You really have to keep the economy from being locked down when it comes to travel. All those jobs associated with the travel industry, I think, are most at risk.
Today, President Trump hosted the CEOs of several major health insurance companies here at the White House, announcing they have agreed to waive the copays for people who are tested for coronavirus, which covers about 240 million Americans. Tanya?
Weijia at the White House, thank you so much. Coming up after the break, more passengers leave a cruise ship in California to begin a 2-week quarantine. Why some are not happy with the process. Plus, we will check in on a Seattle area nursing home at the center of a big virus outbreak, what the Washington governor is now imposing. You're streaming CBSN. Michigan is poised to play a pivotal role tonight, where 125 pledged delegates are at stake. It is arguably most important for Senator Bernie Sanders. He is again looking to the Great Lakes state to help propel him forward. You will recall Sanders narrowly edged Hillary Clinton out there in 2016. It was considered a major upset and helped keep his campaign afloat. There hasn't been consistent polling out of Michigan, but a new Monmouth University poll has former Vice President Joe Biden leading Sanders there by 15% among likely Democratic voters. It is worth remembering Donald Trump became the first Republican presidential candidate to win Michigan since 1988. He won the state by nearly 11,000 votes. For more on what's at stake, I want to bring in Lavora Barnes. She is the chair of the Michigan Democratic Party and joins me now from Detroit. Hi, Lavora. Thanks so much for being with us. You know, as we mentioned there, Sanders hopes to reinvigorate his campaign in Michigan. Do you consider the state a must-win for him? And what type of electorate is he going after there?
I think the state's a must-win for either of these candidates. We've got 125 delegates up tonight, and that's a big number compared to other states that are up tonight. And I think for either of these two candidates, this would be a big deal. You know, we are a very diverse state. You know, we are more diverse than some of the states that have come before. We look a little bit more like America than some of the states that come before. And I'm excited to see what these numbers will look like tonight.
And so, Lavora, let's talk about Joe Biden a little bit. What group of voters does it appear the former vice president is translating best with there?
I think both of these candidates are doing a great job of talking to a diverse group of voters here in Michigan. They've had conversations all over the state, both around geography and ethnicity and race. They've done a terrific job of reaching out across all spectrums here in Michigan. It's been good to see.
And yet they do have different messaging, though. What are you seeing right now? Is, you know, who's more receptive right now? Who's being received more warmly? Because especially according to a lot of our, you know, latest CBS News exit polls, healthcare is the top issue for Michigan primary voters. You know, what is the state of the healthcare system in Michigan, and which candidate are voters there sort of, you know, indicating they think will be better on healthcare?
We've been talking all over the state about healthcare because of Trump's broken promises on healthcare, because of what he's done to go after the ACA, Medicare, and Medicaid. This is important to the voters in Michigan, and it's so important to both of these candidates to have this conversation with the voters, and they're both doing a terrific job of having that conversation all over the state. I think that when you're talking to voters here, they're really very interested in getting through this primary, choosing the one they want, and then let's get to this general election in November and turn out Donald Trump.
Right. So that's where the focus is.
Exactly.
Lavora, of course, both Sanders and Biden are relying on that, you know, diverse coalition of Michigan voters that you mentioned earlier. How important is the African-American vote, especially where you are in Detroit?
Yeah, it's very important. You know, Detroit is a majority African-American city. We've seen good turnout here today. Very important vote across the state, frankly. We have African-American voters all over the state. I think some people forget that it's not just Detroit. So a big part of the Democratic electorate, the backbone of the Democratic Party here in Michigan. So very important.
So, Lavora, you also have previously said the party will not repeat mistakes that possibly contributed to President Trump's 2016 victory in Michigan. What were those mistakes exactly? And as party chair, what do you plan on doing?
We didn't have a ground game in 2016 the way we do now. You know, when we woke up after that election and lost, we decided to start working on a grassroots program right away. And we hired organizers. We've got volunteers on the ground. We've been working since 2017, and we haven't stopped. So we've got dozens of folks on the ground as staff and thousands of volunteers who are knocking doors and making phone calls and having conversations with voters about what's important about voting and what's important about voting for Democrats.
Well, Lavora Barnes in Detroit, Michigan, thank you so much for joining us. We really appreciate your time.
My pleasure. Thanks for having me.
At least 28 people have died from the coronavirus in the U.S., and nearly all of those deaths were reported in Washington state. The victims were residents of a nursing home in Kirkland. Jonathan Bigliotti is there with a look at the new measures being taken to prevent the virus from spreading in long-term care facilities.
21 residents at the Kirkland facility now have tested positive for the virus, and families are on edge, forced to communicate through windows. Sisters Carmen Gray and Bridget Parkhill.
It should have been a priority to get everybody tested so they could get all the negative people out of here before they turned positive.
Unfortunately, they waited too long.
There are 64 employees now showing symptoms so far. With the virus now in 10 nursing homes in King County alone, Governor Jay Inslee is sounding the alarm, imposing some of the strictest requirements in the country for older adults at all long-term facilities in the state, including limiting visitors to 1 per day, requiring visitors to wear special protective gear, and screening employees for symptoms before each shift. The CDC is now advising them to stock up on groceries and medicines, stay home as much as possible, and keep space between themselves and others.
And in a sign of the chaos unfolding behind the scenes, Life Care says they believe several of their residents could have died overnight at the hospital, but they say they could not get a hold of state health officials to confirm. Tanya?
Jonathan, thanks.